The biggest obstacle I find for amputees is some of the patients go through a deep depression when they first go through an amputation. It's not the world looking at it, it's how they look at themselves. And I think they think the world's going to look at them differently or their life has changed, and their life has changed. But it's better than the alternative. I felt that patients were getting inferior service and care. If a person's capable of reaching certain goals, the prosthesis shouldn't be the specific thing that's holding them back from that.
Hello, I'm Dr. Greg Vigna. I'm a doctor and a lawyer. I have the privilege to be with a friend and colleague I've known for many years, Cary Frounfelter.
Hi, nice to meet you.
Cary has a unique perspective because he himself is a traumatic amputee. Cary, tell me your story in terms of when you got injured, how you got injured.
I was at an accident in 1987 in February. There was two vehicles chained together. One was pulled out of a ditch. I walked up to unhook the chain, and there was probably 20 parked cars, and it was actually a prison guard that just got off work, and he was talking to one of his coworkers in his car and didn't pay attention. He was driving through an accident at 75 miles an hour, and he hit the car in front of me and pinned me between that car and my car at 75 miles an hour.
And you had a mangled extremity?
Yeah, I had a very mangled extremity. I was very fortunate it wasn't both legs.
Do you still have vivid memories of that accident, or has that faded over time?
It faded. What happened with mine was when after the accident, I was put in Shands Hospital, which is University of Florida, wonderful hospital. I had 19 surgeries over 3 months. I never got to leave the hospital, trying to save my leg. And then Dr. Hoffman, I brought him in my room on a Friday, and I said, "Hey, doc," I said, "I don't think I'm gonna leave here alive." So I lost my leg. I probably had about 2 years left, and I would have been able to graduate with my architecture degree. I was having such a tremendous problem getting a prosthesis that would allow me to do what I wanted to do. I was at the prosthetic office all the time, carrying my prosthesis back to the gentleman in a box, broken. And he would tell me, "Well, you're just too rough on it. You're demanding too much." And I felt like, so I could still do what I wanted to do, but your prosthesis couldn't. I just needed a better prosthesis. So I went into the field of prosthetics. We take care of a lot of patients that have lost limbs due to multiple reasons. Some of the patients have lost their limbs due to blood circulation, PVD. Some of us can be contributed to diabetes, smoking, could be hereditary, but still the circulation becomes the issue that leads to wounds and then eventually to infections that leads patients to amputations. That's the majority of our amputations. We do still have trauma, whether the person's either in a vehicle or in some type of work accident, as well as it could be military. So this is the field that I've been in for 37 years, and I love it. We also do partial feet. So anything from a great toe being amputated to a transtibial. So when somebody says that below the knee amputation, it's truly a transtibial. We also do knee disarticulations. We do above the knee or transfemoral. So that's multiple types of sockets that are all involved. So they're different ones. That's just your lower extremity. The upper extremity, we do the myoelectric prosthetic arms as well as the body-powered prosthetic arms. It matters what a patient's doing. I have a lot of farmers that prefer to have the body-powered prosthetic arms because they're putting the arms through a rigorous day. The other things we do is making sure the prosthesis is strong enough. I have a gentleman that weighs 300 pounds and he's 6'4", but he works as a maintenance man. If somebody says, "Well, okay, I gave him 300-pound componentry, and it's his fault if he breaks it." Well, no, his needs are 500-pound componentry because of what he has to do on the job. So you have to look at the person more than just the person sitting in front of you. You got to look at their whole life, their desires, things that have to make their life work and function. So it's not a one-size-fits-all. It reflects their personality, and we want them to be happy. We want them to be proud of their prosthesis. So we do anything from sports to Christian, to whatever thing you want on a picture of your family. So we take those pictures, whatever they want, or designs. I had a patient, she makes quilts, and I took a picture of her quilt, and that's the design of her leg, is one of her quilts. I love doing prosthetics because I get instant gratification. Jamaica had a need of prosthetics. I had a young boy in Jamaica. He was 5 years old, and he was born without his limb. So we had one little boy, he was 5 years old. He goes, "I just want to walk one time." And then we fit him with his prosthesis. He was running. Now he's 14 years old. He plays on the local club soccer teams. He does everything every other child does. So, and then one of my patients down there, she's recently passed away. She was a bilateral above the knee amputee. She was the swim coach for the Olympic team for Jamaica. And she would take her prosthetics off and swim in the pool with and train with her athletes. She was very special. I have a congenital young man that I've known for years that played in the NFL, and he went to University of Central Florida. He's a twin, and him and his brother both play. They play defensive backs. And when he was born, his umbilical cord was wrapped around his wrist, so his hand didn't form. So his father had to elect to have his hand amputated. But they made it all the way to college, all the way to the NFL without hands. Every patient's asking about, how am I going to take a shower? How am I going to get in and out of the bathtub? How am I going to go to the restroom at night when I wake up in the middle of the night? Do I sleep with the prosthesis or do I take it off when you go to bed? All these questions are valid questions. And I tell my patients the only question that's dumb is a question you don't ask. Because if it comes to you, you should ask it. How's a patient going to go to the restroom at night when they wake up? Well, some patients will use crutches. Some patients will use a walker, and some patients will use a wheelchair. The next thing is the patients are wanting to go, well, what type of activities can I do? We try to get the patients back to doing the activities that they want to do, but we want the patients to achieve every goal that they want and that they physically have the capability to.
I would say to people, don't bump your stump, don't fall. You could add 2 to 3 months to your,
if not more.
Yeah.
You go from being 6 weeks to 6 months.
In terms of determining the type of lower extremity prosthetic, there are some factors that relate to funding sources. Obviously, what prosthetics a person needs to achieve the function that they can potentially gain back. How do you sort all this out?
K modifiers, whether it's K1, 2, 3, or 4. It all matters the payer source. The insurances, they want everybody to be a K2.
They wanted you to be a K2.
Me to be a K2.
Right. And you're coaching football.
Coach football, baseball, I snow ski, I play basketball, yes. I play golf.
So a K2 is a person that this person is expected to have limited community ambulation potential. K3 is fully independent in the community with
community ambulator.
And K4 are the athletes who are running.
Yeah, and I'm closer to a K4. What I found was physiatrists write the best progress notes.
Rehab doctors look past the current function and take a top to bottom look and look at their goals and letters of need. Does that always work, or
they want evidence? And so my physiatrist, and there's a gentleman, his name is Dr. Michael Yu. Honestly, do you feel that they can achieve this? If he goes, yes, he provides me a detailed evaluation, and we've not been turned down yet. Pretty darn impressive.
That's good.
I'm talking about and I don't want to say the insurance, some of them are rough.
They can be. In terms of people who are injured in other places acutely, they have questions. What can people who are injured do to make sure that they get to the best prosthetist?
If it was me and I was anywhere, I would call Amputee Coalition of America. Okay. That's a support group that's based across the whole United States, and it's all charitable. And there are people that volunteer and work with it. And then they'll be able to tell you, because it's mostly ran by amputees.
Well, you're pretty amazing. I mean, your impact on people in this community and allowing me to tell your story. And
thank you.
Cary's a resource. He's available for phone calls.
And you could call me from anywhere. Wouldn't matter for that.
To represent people who have had serious traumatic injuries from motor vehicle accidents, explosions, losing legs because of pressure injuries. And my goal as a lawyer is simply to maximize recovery. And all I can do is work to get the best financial outcome. But part of that is always to ensure that my client has choice. And that choice involves seeing the best doctors, having the means to get the legs and arms that they deserve.
Exactly.